Good evening, Dr. Wilson and James Lee. I chose to do a program evaluation on maternal and child health for community intervention and improved delivery processes and care. The objective is to improve the way preventative health care services are offered, the design implemented and assessed to create a more impactful practice from a community perspective as well as family level, thus improving care in the following areas, which would be delivery of care, communication, low maternal and infant mortality rates, and socioeconomic risk factors. Um, as listed here, you will see the intervention approach and cost effectiveness as objective. Identify and select intervention approach to identify evidence or if more evidence is needed. Clinical preventative services and support. Um, in the review of the program evaluation, for maternal child health, observational interventions took place in a selected community, primarily with low-income mothers and their infants, to assess preventative rates before and after intervention processes took place. As listed here, the maternal and child health outcomes reviewed were increased preventative services within primary care and community-based practices, the delivery of care practice models to pregnant women and their children. There was a focus on socioeconomic factors affecting the delivery of care, as well as focus on economically impacted communities geographically, such as the more rural areas, which limited the care that was needed for mother and child. Another focus was the education of women on maternal needs, preventative measures before and after intervention measures, after they had given care, after they had given birth to the child, going forth in those next 12 months. Intervention approaches that took place were focused on communication with women and interventions with major risk factors such as socioeconomic factors, which could be gestational diabetes, tobacco, alcohol related issues, shelter, food to actually give the proper nutrition to the child inside the womb, um, and educational factors as well. Another intervention approach looked at was focused on policy level changes, which resulted in resources at the clinical care level. Intervention approaches are as follows, which were the policy level changes for resources that were needed to care for these women as well as their child, engaged multiple clinical organizations into intervention processes for effective care approach to the maternal and child health, enhanced communication between public and private health sectors for care coordination, especially for the more high-risk mothers that had issues that needed to be taken to a more private type hospital or care centers so that they could get the best care that was needed for development of the fetus in the womb and continued care after giving birth. Intervention designs and delivery of care for overall effective health were some approaches that took place. The delivery of care to high-risk pregnant women, and an increase in the home visits within the first year for parental education on fetal and infant health and development going forward. Some evidence-based effective practices that were noted in this evaluation were the high level and participation of services within that particular community, changes in the delivery of care that took place systemically there, joint contracting and training of staff in that healthcare area, and what was noted was an increase in contraceptive use, as well as a decrease in smoking of these mothers. There were also increased well child visits and a decrease of child injuries that was noted as evidence based practices for the outcome of these models that were looked at. Some clinical preventative tools initially were policy level changes at the state and community level, which led to lasting changes in the organization and financing of care and resources that were needed there to effectively treat these women and their children. Another change was our preventative tool was changes in processes for preventative services and engagement around that for multiple practices and organizations. This in turn reduced the duplication and improved the coordination of care between various practices that were needed, especially within specialized care. The outcomes of family level intervention were comparable in direction and magnitude of the outcomes from previous randomized trials. However, it was noted that this was a successful trial and that the resources and practices are continuing to go forth after a 3-year study on this. If you have any questions or concerns, please feel free to reach out to me. Thank you and have a good evening.